My name is Savyasachi Thakkar. I'm an orthopedic surgeon at Johns Hopkins. I specialize in hip and knee reconstruction. I work at the Howard County General Hospital. Hip fractures are a common condition in the elderly and also in the active individual if they were involved in a traumatic episode such as a car crash or a sporting injury or a high-intensity fall. Typically, patients with hip fractures are unable to walk and they should seek medical care as soon as possible. At the Johns Hopkins Howard County General Hospital, we have a hip fracture service that specializes in caring for patients with hip fractures the moment they enter the emergency room. We start in the emergency room, optimize patients for surgery, and within 24 to 48 hours, we get patients to the operating room to perform a surgery to fix their hip fracture or replace their hip. Hip fractures come in several different shapes and varieties. The closer the hip fracture is to the ball part of the hip bone, the more likely that the blood supply is impacted. In that case, we would proceed with a hip replacement surgery to give a patient a brand new joint. If the fracture is away from the ball and the blood supply is not compromised, we could treat the fracture with fracture fixation devices to allow excellent mobility without compromising the function of the joint. One option is using multiple screws placed inside the bone. A second option is to use a screw and plate construct. And the third most commonly used option is to place an intramedullary nail into the thigh bone to allow excellent function after the surgery. Application of fracture fixation devices is typically performed in a minimally invasive fashion. In some cases, the socket is not involved in a hip fracture, and we can preserve the patient's native socket by performing a partial hip replacement surgery. In that case, we only replace the ball and place a titanium implant into the femur or thigh bone to provide excellent stability and function. We believe in multimodal pain control. We do not rely on just one agent, but we have a combination of agents such as anti-inflammatories, nerve-related medications, opioids, nerve blocks to help patients recover faster from their procedures and to also try and achieve pain control before these procedures. At Johns Hopkins Orthopedics, in conjunction with the physical therapists at the Musculoskeletal Center in Columbia, we typically employ activities such as the zero-gravity treadmill, the anti-gravity treadmill. We also specialize in water-based exercises or aquatherapy in order to achieve better outcomes while providing less pressure to the joint. A growing concern that patients have is metal allergy, especially allergy to the implants that we use in hip and knee procedures. In the hip, the metal is titanium and patients are not allergic to titanium.